Every 40 seconds, someone in the United States has a stroke. For older adults, it is one of the leading causes of death and the primary cause of long-term disability. But here's a shocking truth. Most of these strokes could be prevented, or their damage minimized, if the warning signs were recognized early. Imagine this. You are having a casual conversation with a loved one, and suddenly, their words become slurred. One side of their face begins to droop, or one of their arms feels weak and cannot be lifted. Would you know what to do? Sadly, many people do not. They hesitate, thinking the symptoms might pass, or they fail to recognize them as signs of something serious. But in the case of a stroke, time is everything. Every minute of delay means more brain cells are dying, millions with each passing moment. Stroke is not just an age-related condition, it is a medical emergency. When blood flow to the brain is interrupted, even for a few minutes, critical brain cells begin to die. This damage can lead to life-altering consequences, from paralysis and memory loss to difficulties with speech and understanding. But the good news is that recognizing the symptoms early can save a life. In the United States, over 795,000 people suffer a stroke each year, with nearly 3/4 of these cases affecting individuals aged 65 and older. According to the Centers for Disease Control and Prevention, CDC, stroke is the 5th leading cause of death nationwide, but it is the leading cause of severe long-term disability among seniors. For those who survive, the road to recovery can be long and challenging, filled with physical, emotional, and financial burdens. But it doesn't have to be that way. Understanding the warning signs of a stroke and acting quickly can dramatically improve outcomes. In this video, you will learn how to identify the most common signs of a stroke, understand why seniors are at higher risk, and discover what to do in those critical first moments. You will also learn how to reduce the risk of a stroke through practical, science-backed tips, especially for seniors and their families. This is not just information, it is potentially life-saving knowledge. Whether you are over 60, have a family member who is, or simply want to be prepared, this video is for you. Because when it comes to a stroke, knowing what to do can be the difference between full recovery and a lifetime of challenges. So stay with us. What you learn today could save a life. A stroke is a serious medical condition that occurs when blood flow to a part of the brain is interrupted or reduced, depriving brain tissue of essential oxygen and nutrients. When this happens, brain cells begin to die within minutes, leading to potential long-term damage, disability, or even death. Understanding what a stroke is, how it occurs, and the different types can be the first step in saving a life. There are 3 main types of stroke, each with distinct causes and effects. The most common type is ischemic stroke, accounting for about 87% of all stroke cases in the United States, according to the Centers for Disease Control and Prevention, CDC. This type occurs when a blood clot blocks or narrows an artery supplying blood to the brain. These clots can form in arteries damaged by fatty deposits, known as plaque, a condition called atherosclerosis. Alternatively, clots can travel from other parts of the body, such as the heart, and lodge in the brain's blood vessels, a condition often seen in individuals with irregular heart rhythms like atrial fibrillation. The second type is hemorrhagic stroke, which occurs when a blood vessel in the brain bursts, leading to bleeding in or around the brain tissue. Hemorrhagic strokes are less common, but far more deadly. The primary causes include high blood pressure, which weakens the walls of blood vessels over time, and aneurysms, weak bulging spots in the blood vessels that can rupture. Another possible cause is arteriovenous malformations, AVMs, which are abnormal tangles of blood vessels that can rupture unexpectedly. Finally, there is the transient ischemic attack, TIA, often referred to as a mini-stroke. Unlike the other 2 types, TIA is a temporary disruption of blood flow to the brain that does not cause permanent damage. It may last only a few minutes or up to an hour, and is often a warning sign of a more severe stroke to come. Experts describe TIA as a critical red flag, indicating that a major stroke could occur in the near future without immediate medical attention and lifestyle changes. Understanding the mechanisms of stroke can clarify why it is such a dangerous condition. In an ischemic stroke, the lack of blood flow means that brain cells in the affected area are deprived of oxygen and glucose, their primary sources of energy. Within minutes, these cells begin to die, and the affected brain region can lose its ability to function. If the stroke affects the area of the brain responsible for speech, the individual may experience slurred speech or difficulty understanding language. If it impacts the area that controls movement, one side of the body may become weak or paralyzed. In the case of a hemorrhagic stroke, the bleeding causes direct damage to brain tissues and increases pressure within the skull, further worsening the damage. This pressure can push healthy brain tissue aside, disrupting its function. The more severe the bleeding, the greater the damage. Stroke is a leading cause of death in the United States, ranking 5th overall, but for seniors the risk is even higher. Nearly 3/4 of all strokes occur in individuals age 65 and older. This high risk among older adults is due to factors such as weakened blood vessels, a greater likelihood of high blood pressure, and the presence of other underlying health conditions like diabetes or heart disease. According to CDC statistics, stroke is the primary cause of long-term disability in older adults, leaving many with reduced mobility, speech difficulties, and cognitive impairments. Recognizing these types of strokes and understanding their causes is essential, but it is just the beginning. Knowing how to spot a stroke and take immediate action can dramatically improve the chances of survival and recovery. In the next section, we will explore why seniors are at a higher risk and what makes them more vulnerable to this life-threatening condition. As people age, the risk of experiencing a stroke increases significantly, and this is not a coincidence. Numerous factors make seniors more vulnerable to stroke, transforming it into a leading cause of death and disability among older adults. Understanding these factors is essential for both prevention and early intervention. One of the most significant risk factors for stroke in seniors is high blood pressure, hypertension. According to the American Stroke Association, 1 in 3 older adults in the United States has high blood pressure. Over time, the constant pressure exerted on artery walls can damage them, making them stiff and prone to rupture or blockage. This condition is known as atherosclerosis, where fatty deposits build up inside the arteries, narrowing the blood vessels and restricting blood flow. High blood pressure is often called the silent killer because it can exist without symptoms for years, quietly increasing the risk of stroke. Heart disease is another major concern. Conditions like atrial fibrillation, a type of irregular heartbeat, can cause blood clots to form in the heart. If one of these clots travels to the brain, it can block a blood vessel and trigger an ischemic stroke. Coronary artery disease, where blood flow to the heart itself is reduced, can also increase stroke risk. Seniors are more likely to suffer from these heart conditions due to the natural aging of the heart and blood vessels. Diabetes is another critical risk factor. It not only damages small blood vessels throughout the body, but it also increases the likelihood of high blood pressure and high cholesterol, both of which further raise the risk of stroke. Diabetic patients are also more prone to atherosclerosis, where arteries become thickened and stiff, restricting blood flow to vital organs, including the brain. A sedentary lifestyle and obesity further compound the problem. Many seniors, due to reduced mobility or lack of motivation, become less physically active. This lack of physical activity can lead to weight gain, which in turn raises the risk of high blood pressure, diabetes, and heart disease, all of which are stroke risk factors. Regular physical activity helps maintain a healthy weight, improves circulation, and strengthens the heart, but many older adults find it difficult to maintain an active lifestyle. The natural aging process itself also contributes to higher stroke risk. As people age, their blood vessels lose elasticity, making them more prone to rupture under pressure. Plaque buildup within the arteries becomes more common, further narrowing these vital pathways for blood flow. Inflammation, which increases with age, can also damage the lining of the arteries, creating the perfect conditions for a clot to form.
According to the American Stroke Association, people aged 65 and older are 4 times more likely to experience a stroke than younger individuals. This statistic is not just a number, it is a clear reflection of how the combination of age-related conditions and lifestyle factors converge to increase the risk. Recognizing these risks is crucial because many of them are manageable. By controlling blood pressure, maintaining a healthy weight, staying active, and managing chronic conditions like diabetes, seniors can significantly reduce their chances of having a stroke. Understanding why seniors are at greater risk of stroke is only the first step. Recognizing the warning signs and knowing how to act can be the difference between life and death. In the next section, we will explore these warning signs in detail and show how early detection can save lives. Recognizing the warning signs of a stroke is critical because every second counts.
When a stroke is suspected, immediate action can be the difference between life and death, between full recovery and lifelong disability. The first and most critical step is to call 911 immediately. Do not wait to see if the symptoms go away, and never attempt to drive the affected person to the hospital yourself. Emergency responders are trained to provide life-saving care on the way to the hospital, which can be the difference between a positive and a devastating outcome. Once 911 has been called, make sure the person is in a safe and comfortable position. Ideally, they should be laid down with their head slightly elevated. This position helps maintain blood flow to the brain while reducing pressure. Never give the person food, drink, or medication, as they may have difficulty swallowing, which increases the risk of choking. Stay calm and provide reassurance, keeping the person as relaxed as possible. If they lose consciousness, be prepared to provide CPR if you are trained to do so. When emergency responders arrive, they will begin an initial assessment, often using the FAST method, face, arms, speech, time, as a quick diagnostic tool. The patient will then be transported to the nearest stroke center or emergency room equipped to handle stroke cases. This is where the next critical phase begins: treatment. All for ischemic strokes, which account for about 87% of all strokes in the United States. The primary treatment is to restore blood flow to the affected area of the brain. This is usually done with a medication called tissue plasminogen activator, TPA, which is a clot-busting drug that dissolves the blockage. However, TPA is most effective when administered within 4.5 hours of symptom onset, which is why the concept of the golden hour is so critical. The faster this drug is given, the better the chances of recovery. In some cases, when TPA is not enough or cannot be used, a more advanced procedure called endovascular thrombectomy may be performed. In this procedure, a specialized doctor inserts a catheter through an artery, typically in the groin, and navigates it to the blocked vessel in the brain. A stent or other device is then used to physically remove the clot, restoring blood flow. This technique has proven highly effective for large clots and is a key tool in modern stroke treatment. For hemorrhagic strokes where a blood vessel in the brain has burst, the focus of treatment is to control the bleeding and reduce pressure within the skull. This can involve surgery, such as clipping an aneurysm, placing a metal clip to stop blood flow, or coiling, inserting a coil to block blood flow. In other cases, medications are used to reduce blood pressure and prevent further bleeding. Doctors may also administer drugs to lower brain swelling and prevent seizures, which are common after a hemorrhagic stroke. Regardless of the type of stroke, the importance of time cannot be overstated. The American Stroke Association emphasizes the concept of time is brain. For every minute that a stroke goes untreated, nearly 2 million brain cells die. That is why fast action, from recognizing the symptoms to receiving professional care, is essential. Studies show that patients who receive treatment within the first few hours of symptom onset are far more likely to recover with minimal disability. But the journey does not end with emergency treatment. Even with the best medical care, stroke survivors often face a long path to recovery. Physical therapy, speech therapy, and occupational therapy may all be needed to help regain lost skills. Emotional support is also critical, as stroke survivors may experience depression or anxiety. Families play a vital role in this recovery process, providing encouragement and understanding. Understanding the importance of acting quickly and knowing the treatment options can save lives. In the next section, we will explore how to reduce the risk of a stroke in the first place and how to support a loved one through recovery. Preventing a stroke begins with adopting a healthy lifestyle, especially for seniors who are at higher risk. One of the most critical factors is controlling blood pressure. High blood pressure, often known as the silent killer, is a major cause of stroke because it weakens the arteries over time. Regularly monitoring blood pressure and maintaining it below 120/80 mmHg can significantly reduce the risk. This may involve lifestyle changes such as reducing salt intake, managing stress, maintaining a healthy weight, and taking prescribed medications consistently. For those with diabetes, controlling blood sugar levels is equally important. High blood sugar damages blood vessels, making them more prone to blockages, which can lead to an ischemic stroke. Regular monitoring of blood sugar, following a balanced diet, exercising, and adhering to prescribed medications can help keep diabetes under control and protect the blood vessels. Another critical measure is to quit smoking and limit alcohol consumption. Smoking damages blood vessels, increases blood pressure, and promotes clot formation, all of which raise stroke risk. Similarly, excessive alcohol intake can increase blood pressure and cause irregular heart rhythms. For most adults, it is recommended to limit alcohol to 1 drink per day for women and 2 for men. But for those at high risk of stroke, avoiding alcohol altogether may be the best choice. Regular physical activity is another powerful way to prevent strokes. The American Heart Association recommends at least 150 minutes of moderate-intensity exercise per week, which can include brisk walking, swimming, cycling, or even dancing. Physical activity helps maintain a healthy weight, improves circulation, and reduces the risk of hypertension and diabetes, two major stroke risk factors. A Mediterranean diet is also highly recommended for stroke prevention. This diet emphasizes fruits, vegetables, whole grains, nuts, and healthy fats like olive oil, while limiting saturated fats, red meat, and sugary foods. Numerous studies have shown that following this diet can reduce the risk of cardiovascular diseases, including stroke. For seniors, making simple dietary changes, like replacing butter with olive oil or choosing fish instead of red meat, can make a big difference. But even with the best prevention, strokes can still occur, and recovery is a critical phase. Physical therapy is one of the mainstays of stroke recovery. It helps patients regain strength, balance, and coordination, allowing them to become more independent in their daily activities. Therapists may use exercises, walking training, or balance activities to rebuild muscle strength and control. Speech therapy is essential for those who have experienced communication difficulties due to a stroke. Speech-language pathologists help patients regain the ability to speak clearly, understand language, and even swallow properly. Depending on the severity of the stroke, therapy may focus on helping patients find the right words, speak more clearly, or improve their ability to understand others. Emotional and psychological support is also crucial. Stroke can be a traumatic experience, leading to anxiety, depression, or feelings of isolation. Both stroke survivors and their families may benefit from counseling, support groups, or simply talking openly about their feelings. Encouragement and understanding from loved ones can significantly boost a patient's motivation to recover. Finally, prevention and recovery are not separate processes, they are continuous. For stroke survivors, preventing another stroke is just as important as recovering from the first. This means maintaining a healthy lifestyle, adhering to prescribed medications, and attending follow-up medical appointments. Regular checkups with healthcare providers can help monitor blood pressure, cholesterol, and other risk factors, ensuring that they remain under control. In the next section, we will summarize all the essential points discussed, reinforcing the importance of recognizing stroke symptoms
taking immediate action, and adopting a healthy lifestyle to prevent strokes.
Stroke is a life-threatening medical emergency, but with the right knowledge, it is also one of the most preventable and manageable conditions. Throughout this video, we have explored the critical aspects of stroke, beginning with recognizing the warning signs: sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, difficulty speaking or understanding, loss of vision, dizziness, and a severe headache with no known cause are all warning signs that must never be ignored. Using the FAST method, face, arms, speech, time, can help you quickly identify a stroke and take immediate action. We also discussed the importance of rapid response. When a stroke is suspected, every second counts. Calling 911 immediately, avoiding self-transport, and ensuring the person is positioned safely can make a life-saving difference. We then explored how stroke is treated, from clot-busting medications for ischemic strokes to surgical procedures for hemorrhagic strokes. Understanding these options empowers you to act quickly and appropriately. But prevention is always better than cure. Maintaining healthy blood pressure, controlling blood sugar, avoiding smoking, limiting alcohol, staying physically active, and following a Mediterranean diet are proven ways to reduce your risk of stroke. For stroke survivors, recovery is possible through physical therapy, speech therapy, and emotional support, helping them regain their independence and quality of life. Now that you are equipped with this life-saving knowledge, it is time to take action. Share this video with your family and friends, because awareness is the first step to prevention. Encourage them to learn the signs, understand the risks, and be prepared to act. If you found this information helpful, please like this video, subscribe to our channel, and turn on notifications so you never miss our latest health tips. Your support allows us to continue providing valuable information that can save lives. Remember, knowledge is power, and in the case of stroke, it is the power to save a life. Stay informed, stay healthy, and protect yourself and your loved ones.